This is Esther Turner with Mindful Mondays, and it's really a beautiful day out here. It's a mindful day. And I have brought in with me someone that I have aspired to for a long time and have wanted to talk to her. And today I have Vivian Creekmore with me. And welcome to the studio here today, Vivian.
Hi, thank you for having me, Esther.
Well, you know, I'm happy that you came in, and it's been a long time since I've seen you. And so today we are going to lead into a lot about what my program is about. And my program, a lot of people are confused on what mindfulness is. But let's first talk a little bit about Vivian. Vivian, you have come to us. You live in Janesville, is that correct?
That's right.
And
lived in Madison before that, and grew up in Kentucky. Went to school in Seattle. So
okay,
lived in North Carolina.
And lived in North Carolina. So real quick, because right away when I think of Kentucky, I think of those big hats. Did you ever aspire to one of those big hats?
I have those big hats. My daughter graduated from an MSW program at George Williams University on Kentucky Derby Day this year. And so we had a derby party with mint juleps and a big selection of Kentucky bourbons and big hats.
Oh, my word. You know, right away I'm getting excited because I'm in love with hats, and that's something that my mother had started me out from, coming from Chicago, and I just have huge hats, and at one point I ended up giving a lot of them away, but for some reason I've started to reconnect with them, and in that reconnection, I don't know, what is it about wearing a hat? How does that make you feel?
Well, I wonder did you wear them when you were a child? Did you go to a church where people wore hats?
We did. We did.
Yeah. We really dressed up for church when I was a child. And so I was wearing hats and gloves and matching pumps, probably, I don't know, by the time I was 14. Then, of course, that kind of went out of style, so in the 60s.
Well, you said another word here that resonates with me, and that word was gloves.
Yes.
Gloves. You don't see that very often, and for me, having a pair of gloves to match the outfit really put everything together. And so for you listeners out there that are resonating with this, you could just about tell where we're coming here from, Kentucky and Chicago, wearing gloves and big hats.
Yeah, I think you can guess our ages, too, probably within 2 years.
I was alluding to that, actually.
Yeah.
But what a great time. And interesting enough, I believe, in viewing some of the fashion areas, that hats are coming back in. So
I hope so.
So you and I, we're just going to have a hat day.
Yes.
Not red hat, but just Vivian and Esther Day wearing our hats. So again, if you see us, be sure to remind us on that.
Tell us how good we look.
That's important. Tell us how good we look. So, you know, you've lived in several places. You mentioned your daughter. And what else is happening in your life? I can cheat because I follow you on Facebook, but share some of that information about Vivian.
Well, let's see. Current, what's going on with me currently?
Whatever you'd like.
Whatever I'd like. Well, I just had a total hip replacement on the right side about 6 weeks ago, and I'm having another one in about 2 weeks, the left hip. Done. So that's been my big news. My daughter I have a master's in social work and was a therapist and consultant, and she just got a master's in social work. And
well, how exciting! It's in the family.
It is.
But let's talk a little bit about that down the road. But what I want to kind of segue back here about the hip thing, because I know a lot of individuals who have gone through that kind of surgery. And I did follow you on Facebook, knowing that there was like a precursor of getting prepared for this. And you had your surgery again in where? In Madison?
At UW.
Okay, that's where my daughter works.
Orthopedic surgery program there. Yep.
And so they really have some wonderful doctors there.
They do. And one thing that was, I had worked at UW, which I'm going to talk about in just a minute, years ago. And as an employee there, it did not strike me as a really organized place. You know, so So having worked there was part of my fear of the surgery. I've sort of seen the inside, how the sausage is made, sort of, and now I don't want to eat it.
But and the sausage place has gotten bigger.
Yeah, so yeah. It's much bigger. So, and so that probably. Having worked in healthcare contributed the most to my anxiety. But the orthopedic clinic is and surgery department is the most organized endeavor I have ever participated in. And I have a really well-known and well-respected doctor, and everything just was smooth as glass.
You know, I'm happy to hear you say that because, I've had the wonderful opportunity of having UW Hospital put me back together. And I've been put back together more than once. And I don't like hospitals, unfortunately, in terms of having to stay at a lengthy period of time. I just want to go in, get fixed, and turn around and leave. So what was your stay there?
My stay was really short, and I probably could have come home sooner as far as my hip was gone, but I had a super bad headache and was getting nauseated every time I sat up. And so that could have been from the anesthesia, and it could also have been because I didn't know this in advance, but everyone's not laying flat on a table for the type of surgery they have, which is what we picture on TV.
Of course.
So for hip replacement surgery, you might be the table might be rotated on the side. You're packed in with pillows. My arms were probably above my head for the entire hour and a half surgery, and that could have been what caused the headache.
I would say so.
So I'm a researcher. I research the heck out of everything.
Good for you.
I did not want to know a lot about the details of this surgery because I probably wouldn't have had it if I had. I know it's gruesome. They're sawing your femur in half and pulling it out and pounding in a titanium.
Well, Vivian, I'm laughing with you, not at you, but I tell you what, that's a true warrior. A true warrior, knowing that there's some things that you want to know a little bit about, but you don't want to know the full detail. And it brings me back to a lot of my research over the years. Just give me enough information that I can be mindful about what's going to happen.
I chose what I thought was the best doctor there was and the best place for me. And if it had been if it had been someone else's surgery, I would have researched it to death. But it still makes me a little queasy. But one I am, I have various ideas that I sell, one of them being meditation. But one thing I've been wanting to sell to people, so many people now view the treatment or the medicine as the problem. And arthritis and pain was my problem. The surgery is the treatment. That's the cure. That's the solution. And so people go, oh, no, when you tell them that you've had a certain surgery. When people are diabetic and someone finds out they're on insulin, they go, oh, no. Well, insulin's a miracle drug. It is the cure. It's not the problem. Diabetes is the problem. So that's maybe comes from my having worked in healthcare, but that's my view of it.
Well, and I think that's important too, because there's so many people that they try to put a Band-Aid on things, and then they're not really aware of what the core issue is all about. And so obviously some of the things we're going to talk about today is mindfulness, meditation, and breath work, and how that comes in. It's not the cure-all, but it can facilitate. And I'm glad that you are healing well.
Yes.
And we'll certainly have to get our ducks in order when you go in for the second one, and maybe have this a little bit more easier for you so you don't come up with those headaches, which is uncomfortable. So with that said, Vivian, we're just going to take a small little break here. So I'm just going to have you pause a minute here. And I want all our listeners to stay tuned, because we have in the house today Vivian Creekmore. And she's going to share with us about her background and how she got involved in mindfulness. And so this is Esther Turner with Mindful Mondays. Well, here we're back again. Vivian, you ran around the block there a couple of times during the break. Go, girl. We're talking to Vivian Creekmore. It's Esther Turner with Mindful Mondays. And Vivian's sharing with us a little bit about her background, that she's had surgery. And we started talking about your health, occupation background. Would you share a little bit about that with the listeners?
Sure. I haven't worked in quite a while, but I was a psychiatric social worker. I worked a little bit with developmental disabilities, a short while in probation and parole, and the rest of the time I worked in psychiatry or as a social worker on medical units. And I worked on a trauma unit and a burn unit, as well as psychiatry.
Those are major.
Big, bad stuff. And that in school and in my profession, I had studied various behavioral methods for addressing anxiety and depression, and including progressive relaxation, guided imagery, and a little bit about hypnosis. So when I began working there, a lot of those patients aren't conscious, but for those who are, it's incredibly anxiety-provoking. I mean, they may be facing death, their future is uncertain, they don't know if they're going to make it, they've had horrible accidents. We treated spinal cord injuries and head injuries and people with multiple body system failures. So what I started doing was using those techniques.
How long ago was this?
This was been like 30 years ago, so it
Did
took
you
a
hear
long
that,
time
listener?
for this to come back to
30
me.
but
years I was
ago.
only 10 when I started working, so as a psychiatric social worker. So,
good for you, Vivian.
I was very precocious.
Good for you. But 30 years, and that's interesting that you should bring that up, because it was 30 years ago that I started meditating. So you found out in this profession with working with burn victims and individuals with serious injuries.
Yeah, and I didn't start myself. I actually heard someone, I just called this my mix of things. The patients were in bed. Most of them were intubated, so they couldn't speak. And I did a combination of using message boards and guessing and speech reading and asking yes and no questions. And some people actually even had to blink to answer a question. But all of these patients were hooked up to telemetry. All of the patients' heart rate, blood pressure, and respiratory rate were being measured on monitors that I could see as I worked with them. So I started doing, like I said, someone has called it hypno-meditation. I started using progressive relaxation and guided imagery and a little hypnosis to address their anxiety. And I interviewed people, difficult. I have to ask a lot of, are you anxious? Are you depressed? How anxious are you? On a scale of 1 to 10, is it a 1? Is it a 2? Is it a 3? So a difficult work situation. But what happened is, and they couldn't control their breathing, so I couldn't say, take a deep breath. So I would ask people, maybe, where's the safest, most comfortable place in the world to you? Is that your home? Is that, try to find out some things about them. And then I would do a combination of guided imagery and with a hypnotic induction, like I want you to close your eyes, relax, let go of all of your worries, don't think about anything but my voice, and I want you to feel yourself going downstairs, and every step down you take, you become more and more and more relaxed. And then after an induction like that, then at the bottom of the stairs, I might say, you find yourself on the street in front of your house. You are walking toward the door. You open the door and walk in. Some people, when you say open the door, their hand will reach out. Absolutely. And they will turn the knob.
And, it's interesting that you should talk about this. I want to back up just a little bit, Vivian, because I'm intrigued with what you are saying here in terms of the type of patients that you worked with. And I think the one that really struck my mind right away is that you are working with individuals that are having trouble breathing. Mm-hmm. You are working with individuals that have a high anxiety. And you are working with individuals that may not be totally coherent. Is that correct?
Correct.
So that is really difficult when you are trying to communicate. So interestingly enough, that guided imagery was such a perfect tool at that time, and still now today. It's a beautiful tool to use in terms of individuals in everyday life that may not have the difficulty of breathing. Maybe they breathe just beautifully, but I think it's those simple steps and the fact of the matter that you could get through them. You could touch them energetically with your instructions, and you found out that they followed?
Right. And some people, and the interesting thing is that I'm not very suggestible. I'm not a good hypnosis candidate, and I'm very scientifically oriented. But I did hypnosis on a child who was a burn patient, or did this hypno meditation, as I heard it called recently. And I taught him this so he could do it himself during his treatments, which were very painful. And the second time, so I went over this with him, then I went back and he was awake, conscious, alert, and not on a ventilator. Most people were on ventilators, breathing machines. But when I went back the second time, and he heard my voice, and I said, we're going to do this again. So I'd like you to take a deep breath and relax. His eyes rolled back in his head. He was totally into it. Now, that would never happen to me. But what I began to see, and with a few exceptions, like I said, most people were on a breathing machine, and they were hooked up to telemetry, is when I did these with people, I could see their blood pressure drop, I could see the respiratory rate drop, and I could see their heart rate slow down.
So you had some really good tools there in terms of our technology.
Immediate feedback.
And so, and again, it's that immediate feedback that helps a person. And I know that sometimes it's difficult if, let's say, hypothetically, if you were reading a patient and you didn't have those tools, but you have the education that you have, in viewing them and looking at them, it would probably have been a lot more difficult to tell what their heart rate was or if they were breathing properly just by, viewing them. So having the technology to support you was really important.
And all of those three biological indicators, blood rate, heart rate, and respiratory rate, are also related to anxiety, not just to in well people. When people become anxious, their blood pressure goes up, their heart rate goes up, and their respiratory rate goes up. So
I know that one.
Now, I don't know why, I have no explanation for why I didn't think of this. What would have been interesting would have been to see if the same thing happened if I had merely asked them to close their eyes and hold my hand, and I had sang a lullaby or read a poetry to them. It might have had the same response. I don't know.
Well, let me tell you this, Vivian. I've been talking to you here just for a few minutes, and listeners out there, you could probably attest to this too. You have one of those voices, very soothing. And there are many individuals, like my daughter, who is a nurse. She just has a very soothing voice. And so I would gamble to say that even with your voice, being able to calm them would have been also proactive in helping them. Because there's some people that you can be around, and their voice and just being around them helps a person relax. So I'm just going to go out there on record that I just think you have that talent with your voice to have somebody to calm down.
Thank you. And there are people that have very grating voices. We have a friend who's couldn't stand, her children couldn't stand for her to read to them. And she would try to read to them, and they'd say, "Stop, stop." And my daughter couldn't stand my husband's reading.
Isn't that interesting? Now, that would be all another topic, Vivian, sound therapy, which is a whole different program. Yeah. We could probably talk about that some other time.
And I have a theory about some alternative medicines that people believe are helping them, even though there's no scientific foundation for it, such as acupuncture. And I did experiment with acupuncture. And so I think if if your problems have a subjective element, if they have an emotional component and an anxiety component, and you go into a room where soft music is playing and incense is burning and candles are lit, and you have someone lavishing you with loving attention, by golly, I think your headache will feel better. And I think it's that, not the needles. That's my, or also the treatment can stimulate the release of endorphins.
I think that's the key element right there, because I have had acupuncture, Vivian, and I have worked with it for a variety of different things. Interesting enough, allergies, and I've had all those needles in my face, which was quite interesting. Looked like a porcupine. But I do know, going back to what you just said, they do take those needles and put them in the different meridians. But I do agree with you. The setup is wonderful. But I also know in my own personal life, having the needles put in the different meridians was interesting because I could energetically feel the shift. Cure-all as far as allergies, no. But it helped. It helped with some of the things that I was dealing with at the time. Mm-hmm. So, but I find your prognosis here really interesting because absolutely right. If you get into that environment, why wouldn't you feel better?
Yeah, and and I have to say it did not help me at all for arthritis pain. But again, I enjoyed it if it were free. And having this man hovering over me, asking me how I was doing was pretty wonderful.
You got a valid point there. But I'm a strong believer of holistic support. And I do know that there are some wonderful acupuncturists out here. And I do know that some people deal with migraine headaches and have gone to them and have had a lot of success. Arthritis, that's another avenue because I deal with arthritis too, Vivian. So I know all about that. So I think there's kind of like a borderline there depending on...
Well, I think it's a subjective thing. And I told you earlier that I have ideas that I sell. Which just means I'm devoted to. But I have just a very scientific view of life that I think I was probably born with, and there is no research support for acupuncture, no scientific support for it. But if people want to do it, it doesn't bother me.
I don't know that.
Well, I went then years later after my experiences of working on the trauma and burn unit, which was a high-tech intensive care unit, I decided that I wanted to take up meditation during an anxious period of my life, and I had not been meditating.
And how old again are you?
I'm 20 now. I've regressed now. So there was probably 20 years between when I worked there and when I decided to take up meditation. And this was...
and here you're teaching guiding meditation and you're helping them with visualization. Isn't that wonderful?
Right. And I would do some of those things myself sometimes, a special deep muscle relaxation where you go up each muscle group. And
that's powerful.
And also dealing with pain with the arthritis, which I didn't know was arthritis yet. So I decided I would take up meditation. And the basic, without any philosophical or religious thing, just the feel yourself breathe. And I couldn't sit because of arthritis, couldn't sit without pain. So I lie down on the bed straight and with, my spine as straight as possible. And the goal of lying there feeling my breathing. Well, I couldn't do that for 10 seconds. I was like the Energizer Bunny, and my mind is racing, and I'm hopping and leaping and jumping. And
I'm so familiar with people like that. I work with people like that all the time, and it excites me when I hear that.
And those are things I also like about myself. I like the word idiophoric, that you have lots of ideas. I have lots
Idiophoric?
Idiophoric.
Okay, that's a wonderful word.
Yes, lots of wonderful ideas, and I love to think. And But I wanted to meditate, not to think, for at least a few minutes. So I couldn't do it. So what I eased into it, and I would recommend this for people. I don't know why people think they have to sit down, take up meditation, and meditate for an hour in the lotus position when they know nothing about it and have never done it before. So I tried what I call the 20 things practice. And,
I like hearing that, Vivian, because you're talking my talk right now, because so many people have a misconception of what meditation is all about, quieting the mind.
And I want to talk about that.
And stillness, because you do not have to go in an hour. You do not have to do the lotus position. And
you don't have to sit. And in fact, even in Buddha, people come to meditation through a number of different avenues. But even in Buddhism, there's standing meditation, walking meditation, lying meditation, and sitting meditation. And meditation isn't the ultimate goal. The ultimate goal is to live a mindful life in the here and now. And but I could, like I said, I couldn't even lie still. I was hopping out of bed like a jumping jack. So what I started doing was lying, breathing deeply, trying to consciously relax, and then I would lie there and recite 20 things I love about my husband. That was very challenging. But 20 things I love about my daughter, which was much easier. 20 things I like about myself. 20 things I love about my life. And I would breathe deeply and recite the 20 things. And then later...
How did you come up with 20? I'm just curious. I mean, is that a magic number?
I just made that number.
That
number's magic for me. I think in terms of even numbers. 30's too many.
We have a scientific mind with Vivian Creekmore.
With magical numbers.
With magical numbers.
So then when I got more into meditation... and at some point I probably should talk about some of the benefits and insights I've had, but I did gratitude.
And I really, and the word she just said is gratitude, as I was interrupting her. But Vivian, you know what? I'm excited to hear this because we're really picking up speed here. But I'm going to have us just take a little mindful moment here, and we're just going to listen to some soft music, and we'll be back. This is Vivian Creekmore on Mindful Mondays with Esther Turner. In that break, Vivian and I were practicing our breathing.
Yes.
And we were counting.
We're so relaxed that we might not finish the interview. You never know. Well, Esther, this week, before this interview, asked me to watch a, CNN?
Mindfulness with
John Kabat-Zinn.
And Anderson Cooper. 60 Minutes.
And interestingly enough, John Kabat-Zinn is how I got into real meditation. My husband found at the library for a quarter an entire set of his meditation tapes.
Marvelous. I just spent $20.
Yeah. Well, I spent a quarter. And so what I did, again, because I'm so mentally hyperactive, sadly I'm not physically hyperactive, so I don't run, but I would listen to and I have insomnia. That was the other, anxiety and insomnia were some of the motivations, and the pain, arthritis pain.
Did you hear that? We're talking anxiety, and we're talking people who do not sleep. So continue to listen. So
what I would do is I'd get one of his tapes, say session 3 and 4, and I would listen to side 3, and then I'd still be awake. I'd listen to side 4. And so I would just listen to those tapes over and over till I fell asleep. And this is not, I don't know that all the monks and Rinpoches in Tibet would think this is a great way to use meditation, but I often listen to meditation tapes until I fall asleep, or listen to lectures.
Have you, so with John Cabot, I'm not really familiar with some of his tapes, but does he do mantras?
He doesn't, unless it's a very small section. Okay. I believe he's a neuroscientist. I'm not sure what his degree, if it's in psychology or some other neuroscientist. But he works.
He's got a long list of titles, John does.
On the East Coast. And he has been working with people with physical problems, including cancer, terminal cancer, pain, for a long time. And they've done various research projects. For example, they'll assigning people to a group that has one little meeting, and that's it. So essentially a control group. They'll assign another group of people to a support group where they get together with a leader and talk about their concerns. And they'll assign a third group of people to a meditation group and compare the results, sometimes in quite the long term. Recurrence of heart attacks, recurrence of cancer. And now, sometimes I hesitate to say this because there is a tremendous amount of confusion amongst people. I think about meditation and what to expect from it. It's not a substitute for medical treatment. It is not a substitute for therapy.
Correct.
Not a substitute
Correct.
for psychiatric medication and treatment, and it is not a short-term fix for anything. But in conjunction with their medical treatment, even people who just went to a question and answer group did better than people who got no personal attention at all. And the results have been pretty excellent for heart attack, for myocardial infarction. Mm-hmm. So where people who have been meditating, by and large, do much better. Now, you might be one of the people that doesn't do better, and you might be one of the people that does.
I think that's important that you bring that forward because, Vivian, so many people try to find cure-alls, and myself, having taught meditation and been meditating for 30 years, it's not a cure-all, but I will say that if you do apply that to your life, there is a lot of things, a lot of different things. We haven't even talked about that. Maybe we won't even get into it today, including, TM, guided imagery. There's the stillness. There's the mantras, and a lot of those things. But as you said, you have a very busy mind. And in that busyness, you had to find something that worked for Vivian. Right. And I think that's what's important. You have to find something that works for you because everyone is wired differently. We all don't have a calmness. Sometimes that mind just never shuts off. So we have to find something that works with that mind that never shuts off.
Right.
And what you're speaking of in terms of how you walked into this and what you had to do.
And I had to go slowly. Also, and I wanted to share a little bit more about the research. I want to say also that there is not a lot of research, not a whole lot, supporting meditation that's really rigorous research that meets scientific standards. So what happens a lot, like if I did a little research with my 10 clients and I reported the results and it got in the newspaper, then the newspaper might say that Vivian Creekmore did a study that proves that meditation worked, when that study didn't meet any scientific criteria. But I think John Kabat-Zinn is a really reliable person, and some of the most interesting research in the country is being done right up in Madison by a man named Rich Davidson.
Absolutely.
At the Weissman Center.
Absolutely.
And he is the one that has been studying the Tibetan monks. He uses functional MRI, and he does other things with other people, but to me, I would give anything to be starting a new career and persuade him to hire me.
Wouldn't that be wonderful?
Yes.
That'd be wonderful, because, I actually saw on Time Magazine the photograph of the monk from the Tibetan monastery here in Oregon, Wisconsin, and they were doing it at the university in Madison. And I know that the Dalai Lama personally comes and contributes money to help support this research.
Yes.
And so I'm glad you brought that up.
Yeah, he and Rich Davidson have become friends. I think that the Dalai Lama was instrumental in persuading Dr. Davidson to pursue this line of research. And they find now these are people that have meditated 10,000 hours. So I figured I'd have to be at the rate I'm going live to be 200 to accomplish that. And they give them various directions, and then they watch their brain imaging. So it might be to do loving kindness meditation, which is one type of meditation, and then to change to a breath awareness, and then change to this and change to that. And they've studied, now I can't think of the word I'm looking for, how the body fights infection. I guess they gave them a little chemical burn.
Oh.
And nothing to harm anyone, but just a little blister, gave the research subjects, and then compared how fast meditators healed, compare the 10,000-hour meditators, the monks. Not me. To the average person, and they healed faster.
Well, that's interesting you should say that, and I'm happy that you brought that up, because one of the things that was interesting for myself, as I was talking to Vivian earlier before we started the program here today, is that I unfortunately have had an opportunity to have surgeries 2 years in a row. And in that process of surgery, without getting into details what it was all about, I meditated, but I had a situation where they had to put me back together 3 times a week. I had what you call wound vac. For those listeners out there who may know what that is. But during the process of meditating, I did a lot of meditation to help with that process of healing. And the nurses would say, I can't believe how fast you are healing. And I thought, well, it's probably because I'm resting and eating well. But I also was meditating, but I never really took that into account.
Right.
So I'm glad to hear you say that.
Yeah. That's pretty interesting. Another thing that I think is, and I want to say again that meditation is not a substitute for medical treatment or therapy or psychiatric
And I think that's
treatment.
important to bring back in, too, because I think so many people try to exchange. They think that if I incorporate this, then I don't have to deal with that. So it's not a Band-Aid. It's meditation is a support system, but it's not the cure-all. Right. It's something you can bring into your life to support.
Method, out of many choices. And people get into meditation through many avenues. There is a Christian contemplative tradition, the New Age movement, Hinduism and yoga, and Buddhism are 4 of the avenues that people get into it. And I'm participating in some online discussion groups through a phone app that I have that has a lot of, called Insight Timer, if anyone's interested. And there are, what you see on there, the people who, some people, it's like a little knowledge is a dangerous thing.
Right.
They have gone to a yoga meditation seminar.
Okay.
And so they are unaware of how many other methods of meditation there are, or they are familiar with one school or lineage, as it's called, of Buddhism, and they're unaware that there are others. And so you have all these back and forths between people who are correcting each other and saying, no, that's not how it's done, because they all entered meditation through a different door.
And I like the fact that you're bringing that up, because I think that there's so many different avenues out here. And my belief system, Vivian, is that if a person like yourself who has a very busy mind, it doesn't mean that you have to sign up for a certain type of meditation to be accurate or to be successful. And I think that's where a lot of individuals who have very busy minds don't feel successful, because they cannot turn the mind off. And the fact of the matter that there's so many different ways of stillness, there's so many different ways of quieting the mind, being in the moment, being in present time, that a person can apply to. And you have just given a lot of different aspects here that people can get involved in terms of quieting that mind.
Right. And I think the critical factor, I don't think that you have to join a Christian contemplative movement or become Buddhist or even go to a training program through Buddhism, but the bare bones descriptions are to be still, erect, because that helps your breathing. I think that's the reason there's no magic in not slumping. It's not because there's any magic in it, but because you want to facilitate your breathing and feel yourself breathe. When you get distracted or think, just say to yourself, thinking, and then come back to feeling yourself breathe. That is, in fact, one thing I was watching on YouTube, the monk said, now we're going to try two things. First, we're going to try something first, then I'm going to teach you to meditate. So he said, I'd like everyone to close their eyes and just sit there and don't meditate for 1 minute. So everyone sat there with their eyes closed and didn't meditate.
That's called just being. That is just being.
Said, that's not
meditation. Doing. Just to be. Isn't that? Did you find that easy?
Yes.
You found it easy just to be.
I think it's because I'm really a contrarian, So when he told me not to meditate, that made it easier.
I love that. But that's a perfect example, Vivian, to help our listeners understand that. So many people again are confused of what this is all about. With that confusion, stay tuned, because we're just going to take a little bit of time here to be, and we're going to practice just being. So you're listening to Vivian Creekmore here today with me as my guest, talking about wonderful things. And this is Esther Turner with Mindful Mondays. Here we are, right back at the ranch, and we've been talking about really some fun things here with Vivian in terms of her ability to quiet her mind, her scientific mind, so to speak, and all her expressions on things that she has been doing with studying online and some of these groups that she's been with. What is the name of the study group again that you were in?
The online app, it will be in the App Store. There's one for Apple and one for whatever the other one is that I have. Android is Insight Timer.
And you know what? I belong to that one, because it tells you how many people in the United States are meditating all at once.
At the same time that you are.
At the same time as you are. And
some people use only the timer, but there are a bunch of discussion groups. And one thing that has, I see a lot of confusion in those discussion groups. And I think some of that is because people have entered meditation through one avenue, and they don't know there are other ways of looking at it. And I can give you one brief example. Buddhism, by and large, does not believe in a soul. Hinduism does. So people get very confused about whether there's a permanent self. So people who are studying meditation in yoga will say, but there is a soul, there's a permanent me. And then people who are studying meditation through Buddhism will say, no, there's not. And that's a big generalization, because there are probably, I don't know, there must be 1,000 groups of Buddhism. But the other thing that in looking at secular Buddhism, and I'm not a religious person, not any religion, but is that it fits Buddhist psychology. I actually think Indology, the study of Indian religions and Asian religions, was a really big thing in the 1800s. Mm-hmm. I think psychologists probably stole a lot of ideas from them and incorporated it into modern psychology, or they're stealing ideas from modern psychology, and I can't find anyone who knows enough about both to answer that question.
But the point is any of it helping anybody?
I think so. I mean, I think, and maybe people who don't think the way I do wouldn't find this, but I think having a frame of reference in life, of knowing who you are and where you are and how you fit into the grand scheme of things.
I like that. I agree with you, because it's like, and I agree with you on that, because there's so many times, without giving out my age again, I ask myself, as I have gained some years, why am I here and what am I doing? Mm-hmm. I would not have asked that question 20 years ago. But as I progress in my life and knowing that there are things that I've experienced, it's really important for me to look at what do I want to do with the rest of my life? What value do I have? And so it fits with that theme.
Mm-hmm. Right. And another thing I like about Buddhism that fits with the mental health field is probably all or most Buddhists see life as a chain of events. And that's where the concept of karma comes in, except karma actually means the act and not the consequence. And karma isn't generally magic. It means that if I put $1 in the bank every day for 365 days, I'll have $365. If I don't put $1 in the bank, I won't. And this is it's a hard lesson for children to learn. It's a hard lesson for adults to learn, that with exceptions, such as hereditary problems, child abuse, things that distort and change your life that you have no control over, most of what we suffer in life is a consequence of our own behavior.
Right. And so karma is kind of a label that a lot of people misunderstand. I'm happy you brought that word up, Vivian, because you had said sometimes our behavioral patterns is from how we were brought up and how we developed our belief system and how we developed how we operate. And so karma is something that's largely misunderstood, because it doesn't mean that you can't change that. In other words, it doesn't mean that if you have a bad behavior that you're going to be stuck with karma all your life in terms of things that are negative. A lot of people think karma is really a negative thing. But there's another term called dharma, and that dharma is about the good things that we can put into our life.
Yeah, I think another definition of dharma is the teachings. That's one definition, or reality. And that was the day that I made a commitment to see myself as I really am, to see the other people in my life realistically and as they really are, and to understand life as it really is. My life improved 100%.
Wow.
Because life, we are all going to die. That's life as it really is. Children die before their parents, no matter how horrible that is. And I would never get out of bed again. I'm not a hero. I'm not someone who would trudge on. But it is life. It's not unusual. It's not abnormal. I heard people saying the other day, this is not the way it's supposed to be. My child is supposed to bury me. I'm not supposed to bury my child. But that's not true in the reality of life as it really is. And in life as it really is, there are people that are just stinkers. There are people that are liars, cheats, and thieves. There are good people, and people that are mostly good, people that do mostly bad. And instead of railing against that, seeing that as something that we all have to cope with. And for me, that also meant seeing that some people close to me in my life were not good people, and did not care about me and were not good for me. And seeing myself as I really am, I realize that I have been trying to be a braver person my entire life. It's never going to happen. I mean, I'd have to live 100 more years to become a braver person.
Well, it's so funny that you are bringing this up, Vivian, because I'm listening to you, because I myself have been studying spirituality for over 30 years, and I myself am a Lutheran. But it's in that concept of knowing mindfulness. One of the aspects of being mindful is being kind. And sometimes, you brought up the fact about you'd have to live 100 more years to develop, the full potential. And I know
bravery.
Yes. A bravery. And I'm just saying, in my own life, I know that there are days where I just don't feel like being kind. And then I end up judging myself. But there are days where they're just not unfolding really to my liking.
Right.
And so I struggle. I struggle with that vision of I want to be a better person. I want to be kind. I want to be considerate. I want to be compassionate. I want to do all these. But I do have that guideline. But I myself suffer from not feeling totally complete. And I think that's why I'm going to hopefully put in a couple of more years here in my life.
And get done what you want to get done.
Yeah, exactly.
And I think some of the other principles that is just, and there are a lot of things, again, that there's so much misunderstanding about. Like, everyone knows that Buddhist philosophy attacks the idea of attachment, that we shouldn't be attached. And people that take that to mean we shouldn't be loving or kind or close to people. And I just changed that word. We shouldn't be obsessed.
I like that. You are really giving me a jewel here today, Vivian, because that has been a big word that has really bothered me for a long time, is attachment. I struggle with that. It's
I just substitute. I know people that are so obsessed by what they eat that you have to go to their restaurant every time you go out because they're so worried and attached to their food or attached to the kind of movie that they see, that you could meet up with 10 people to see a movie, and if that one person doesn't like it, they are attached to the idea that they can't do anything they don't want to do. And it can be crazy. Both my sisters are in ill health. I used to believe that I couldn't live if one of my sisters died before I did, which is crazy, frankly, just flat out crazy. Life is impermanent. We are all going to die, and everything is going to change, and sometimes that's a good thing. I was worried about my messy house one day, and then I said, what the heck, it's going to fall down in 50 years. Who cares? I don't have to worry about it.
Vivian, I like that attitude. You're really beating my drum here today, because I'm harmonizing with you, because I myself have found out there's so many things that I judge myself for not being who I thought I should be. But as I grow older, I realize that all those belief systems, all those boundaries, all those guidelines, you turn the corner a little bit, and you become more aware. And in that awareness, you don't you use the word attach. You don't become attached. You don't become obsessed with a lot of these outcomes. And through trial and error, I've had to learn that about my house.
Right.
But it was painful. It wasn't an easy transition. I'll tell you that.
No, I like neatness and order, and I don't like junk. And I live with a guy who's just a step short of a hoarder. So that's a relief to me sometimes to think, well, everything's going to end, and that means the bad things are going to end as well as the good things. And so that's a big relief to me. And I like that these principles, they would have to mesh. I'm not going to give up a scientific view of life. They'd have to mesh with psychology and a reasonably scientific view of life for me to embrace them. So I'm never going to take up the more, and I don't consider myself Buddhist at all. I just enjoy researching it.
Well, and I think that's important too. You brought that up because I myself, having a Christian background, I claim work with spirituality, and I also have been doing a lot of study in a lot of different areas. I do favor a lot of the Buddhist concepts in terms of being compassionate and kind, and talking about a lot of different things. But I think one of the things that I had learned recently, in fact, it was a show I just listened to the other day by Richard Rohr, and he talked about change and how we resist change. And it's in that change that we have such difficulty in. And the main thing is we're afraid of control. We're afraid of losing control. So that's kind of like attachment.
Right. It's the same kind of thing. And we are people really want to be in control to a degree that's frightening sometimes. I mean, you just watch the dynamics in a committee meeting, and it's like people are fighting for their lives.
I know.
Just to be in charge of
It's like
something.
they got to make this happen. This has really got to happen, and I will be the front runner no matter what. I will be the warrior of spirit to get this. Yeah. I hear you on that one, Vivian.
And then that's when you need to be able to just laugh about it and let go of your attachment to it, or my attachment to it.
Well, it's so funny. We're talking here, and I'm really enjoying you, Vivian. Thank you for being my guest here today. But right away, I keep thinking of this buzz song that everybody has heard for a whole year. And obviously, I have a granddaughter who is totally enrolled in this musical that's been playing forever, Frozen. I'm talking about Frozen.
Oh.
And they talk about this one concept, letting go. And, of course, everybody learned the song about letting go. And letting go, to me, is a very hard concept. It's almost like the word attachment. I hear the word let go, and right away the hair stands up on the back of my neck. And, you say that you're scientific. I'm more of a rebel, kind of a scientist. And right away that hair stands up on the back of my neck. What do you mean let go? What do you mean let go? And so I try to encourage the word acceptance. Accept what's going on. I can transition into acceptance a lot better than hearing Frozen's "Let It Go." Let it go, let it go. How do you do with that concept of letting go?
Well, I think people vary on that scale, on a scale of holding on for dear life and letting go. I think I probably let go easier than that.
Good girl. Good for you.
Well, it's not all good because I've let go of a lot of people I didn't keep in touch with. In my youth, I moved around a lot. So I love, if I'm in a bad mood, nothing cheers me up like throwing some stuff away. And I hired 2 men in a truck to come out and haul stuff out of my garage. So I like some kinds of letting go.
Well, good for you. Good for you. And I think that's a whole nother concept about clearing out. And I have found out there's so many things that I'm trying to clear out. And in that aspect, we're going to just take one little mini break here. Vivian, this has been just really great. I'm enjoying all the things that you're sharing with our listeners today. So hold on. Do not switch that dial. Stay with us because we're on our way to the finish line. Here we are, once again. This is Esther Turner with Mindful Mondays. Thank you for staying tuned. We got Vivian Creekmore in the house today, and she's sharing a lot of things with us today. We've talked so many different things about attachment and being obsessed with things. We've talked about her experience in her health field with learning how to meditate later on in life, things that she's doing in her own life to make her more comfortable and mindful in that transition. So a lot of wisdom that's coming out of this program here today. So take notes, people. Just take notes. So Vivian, when you are sharing part of your life here, one of the questions I wanted to address to you, what brings you the most comfortable space in your life. What do you do in your life now that helps you feel really comfortable?
Well, I am very attached to my daughter in a very positive way. I enjoy watching her start a career. That brings me a lot of comfort. I'm very proud of the kind of person that she's become, and I just get a lot of joy from that. And I also realize in getting ready for this hip replacement surgery, I moved a bed down into a large family room that we have, and we have so I wouldn't have to go up and down the stairs. And what I've realized is how much I enjoy. Well, I am a night owl. I enjoy being awake and alone at night, and I enjoy being in that large space. And it's just like I get happy at 10 p.m. every day.
Wow, that's the crystal hour.
That's
crystal hour, 10 p.m.
The hour for me. And I love being in that room alone. I'm sorry to my husband, but I love being down there alone, and I love reading. I love watching the news. I am a political junkie. And I don't even know what it's like this. As soon as I walk in, I watch TV with my husband until about 10 or 11, maybe a little later, and then I go into this large room and relax.
That sounds wonderful, because one of the things, Vivian, that's really mandatory for a lot of individuals who become mindful is having alone time. That alone time feeds the individual, whether you believe you have a soul or not. It feeds you, and I myself need that alone time, and that's a rejuvenator. And so it's how wonderful that you have that in your own life, and that you can do what you need to do throughout the day, but then you have time to rejuvenate with Vivian. But with that said, Vivian, I again really enjoyed the information that you've shared with us today. So listeners, you can go to call me up, and we can tell you when this is going to play again, because I will be looping this out through the week. And I want everyone to keep a lookout for Vivian and her hat and Esther, because we will be wearing them, so that'll be a spot-on thing. So with that said, I'd love to have you come back again, Vivian, and good luck with your surgery.
Thank you so much.
And with that said, everyone have a mindful week. Be good to yourself, and take some time out just to breathe and rest. And sometimes life can just be a little bit more comfortable if you don't take it so seriously. With that said, Esther Turner with Mindful Mondays.